A wound check for signs of infection should occur 2 days after the suturing. The reason for the 2-day period is because it has been shown in studies that lay people are very inaccurate in diagnosing infection. Also, if an infection is going to occur, it usually does occur within 24 to 48 hours. As you know, the signs of infection include redness, swelling, heat, pain, pus, and possibly red streaks. The treatment depends on the etiology of the infection. If it is simply a stitch abscess, then removing that one stitch may resolve the problem. If it is underneath the scab, then sometimes removing the scab, deroofing it, and cleansing will remove the infection and the underlying skin is healthy. Nothing else needs to be done. If the infection is deeper, then sometimes all the sutures need to be removed, cleansing needs to occur, and antibiotics if indicated. There are essentially 4 times when you should consider calling in a plastic surgeon. The first and most obvious is when the patient requests it. If a patient strongly desires a plastic surgeon, that patient is not going to be satisfied with any procedure you do, no matter how perfect. The second is when suturing the laceration would be beyond your capabilities. The third is when you have any doubt. At that point, it would be a good idea to call the plastic surgeon as a consultant. You may pick up some ideas that give you enough information to perform the closure satisfactorily. And the fourth is when there are time constraints. If you're in a situation where your duties require you to do so much in so little time, then a plastic surgical procedure may not be possible purely because there's no time to do the procedure. Possibilities for dressing the wound include 1, no dressing at all. This is fairly common for facial lacerations. 2, some sort of antibiotic ointment such as polysporin. I do not use Neosporin because of its reactivity. It can cause an allergic reaction. Third possibility is probably the most common for the trunk and extremities, and that's covering the wound with a non-absorbable gauze. Some people like having some sort of antibiotic ointment underneath the gauze. When removing a suture, remember to pull across the wound rather than against it to avoid undue tension on a newly healed wound. Remember, it takes about 6 months for a wound to mature. So if a patient is not content with their cosmetic result, they should wait approximately 6 months prior to having a secondary plastic surgical procedure. Hepatitis C, similar to hepatitis B and HIV, is one more reason to practice universal precautions when you're suturing. Although it may take 10 years to develop, it is frequently fatal due to hepatic carcinoma and due to cirrhosis. It is usually a progressive chronic disease. Approximately 50 per 100,000 healthcare workers seroconvert per year, and the chance of seroconversion from an HCV positive source is approximately 4 to 10%. We've reached the conclusion of this suturing technique program. It is my hope that this has and will continue to help fine-tune your suturing skills. I'm Dr. Robert Goldweber. Thank you and good luck.